All right, so today we're going to start with maternal physiological changes after birth, and there's a lot of them. Everything is shifting like literally everywhere.
Okay.
And you're just leaking out stuff everywhere.
Got it.
Okay, and there's there's 3 Oh, that's the whole module is maternal physiological changes. Okay, so let's talk about how we can resolve things here after this pregnancy. All right. Oh, I'm hungry and thirsty.
So this is postpartum,
okay.
or not postpartum.
Excuse me.
Postpartum.
That is what we are studying today. She said, is this postpartum? All right, so here we go. So we're going to start with the organ, then we're going to do what we expect to happen for mom, and then how we kind of guide her through that. Okay. So cardiovascular, I mean, obviously we've had a lot of blood loss no matter how you deliver, right? Vaginal birth obviously does not have as much, but you're looking at 300 to 500 mLs. That's still a lot.
Yeah.
But C-section is no big deal, just half to a liter. Yeah.
Wow.
So what you have to be careful of though, I didn't write this down, but this is just something to note. After they come back from C-section, first of all, everybody ignores them all after C-section. It's the most wildest thing. Okay, so I'm gonna tell you what happened to me because this is absolutely horrifying. I had the worst birth experience with Kaden on the planet. So we ended up in emergency C-section. I lost a lot of blood during the C-section because it had to happen really fast. First of all, they forgot to bring my husband in, so that was sort of a big deal. I was like, "Where's my husband?" And they were like, "Oh, we forgot the dad." Yeah, and on top of that, my epidurals only take on one side. Found that out also in head. Oh, and I had a C-section. So I'm screaming and I'm like, I can feel everything. And he's like, you're on the other options for me to put you out and you won't see the birth of your child. And I was like, just do it. So I did it with no anesthesia on one side. Yes, I nearly died. So then afterwards, what they do is they'll send the dad or the partner, whoever, with the baby. And this isn't just my experience. This is just how it goes. So y'all just need to know this because it's like really shitty. So they send dad to wherever baby is. Kaden went to NICU. Oh, this is another thing that's embarrassing. So he was in like major distress. He had meconium, but we didn't really know that. And so he's born and I don't hear him crying, right? So I'm like freaking out. And like Craig, my husband, he like no medical experience whatsoever, pale, like white as a sheet, you know, he just like looking like this. And so nobody said anything. Nobody was telling me anything. There's no crying. You could just hear like wild, like stuff going on. And so I started screaming, what color is he? What color is he? And then I'm like, oh my God, they think like, I'm not sure if it's the dad or not. Cause I just want to know if he was blue. Okay. I just want to know if he was blue, but I guess they thought it was more important for me to test paternity at that time. It was super embarrassing. Anyway, so they send the partner with the baby and they just leave the mom. Like they put you in like, not even postpartum, but they put you in recovery and you're by yourself. Like they pull the curtains and you're just laying there, like cut open, like, you know, just, and it's awful. Like as a nurse, you need to stay with that patient or pull somebody back because it basically just feels like they ripped this baby out. And then now I was just the carrier. Now everybody's caring about the baby. Nobody gives a shit about me, right? They staple your stomach back together. And then they put on an abdominal binder to like keep everything like, you know, and you don't dehiss, except for I had an allergic reaction to the binder. So I broke out in ulcers and blisters all over my stomach. It was horrifying. But anyway, back to the blood loss. So I lost a lot of blood. And after you lose a lot of blood, you're very thirsty, right? So my nurse let me drink 4 liters of those big, you know, like those big things that have at UTMB, like the big mug things. Yeah, I was so thirsty. They let me drink 4. Guess what happened?
You did.
No. I drank 4 liters of fluid in about 20 minutes. So
You're in like water intoxication?
I got hyponatremia really bad. And so I ended up in the hospital for 7 days. So don't let you need to pace her and like let it, that's what I'm saying. Somebody needs to stay with the mom. And I knew I just was like, oh my God, I'm dying, you know? So someone needs to stay with the mom and like pace the drinking again. Yeah, because I ended up with all kinds of electrolyte imbalances because of it. So, you need to know how much blood loss happens for a vaginal birth versus C-section. So expected changes, the plasma volume is going to decrease because estrogen decreases. Walk me through that one.
Estrogen is a clotter.
Well, yeah, it is a tissue plumper, but estrogen also causes fluid retention, right? We know that you get, you know, and so that's why the plasma volume is going to decrease in mom. Her blood volume will decrease by 10 to 15%, which is why IV fluid is very important. Yes. Okay. But cardiac output will increase for the first 48 hours because mom is shifting fluid massively, right? And the heart is used to pumping at a certain pace and with a certain strength because she had double the blood volume for so long, right? So it will eventually, as mom's fluid and electrolytes start to balance out, it'll be normal again by about 6 weeks. If you have to pick anything on the exam, when will it be normal? 6 weeks is probably your best bet. Okay. Stroke volume, end diastolic volume, and systemic vascular resistance will still stay increased. All of the, you know what the stroke volume is? Well, what is it then? I like it when y'all say,
Cardiac output times.
what the? No, that is not true.
Oh.
No. I know what y'all are trying to do, but that ain't it. It's cardiac output equals stroke volume times heart rate, if that's what you're trying to do. Oh, adult 3 is going to be a blast. So what's the stroke volume? Stroke.
How hard your
The
heart is
volume
pumping?
means the amount.
And one pump.
And one pump, it
Yeah,
says
yeah.
what it is. Okay. So because it's used to squeezing so hard because it has so much extra blood volume. Yeah.
Yes.
Okay. And systemic vascular resistance is how much the rest of the body almost pushing basically back against the heart, saying, I don't really need any more fluid at this point. That's because you usually have a little fluid retention. That won't go back to complete normal until about 12 weeks postpartum. Okay. Hematocrit will decrease for 3 to 4 days. That's normal. They lost a lot of blood. Okay. Normal by about 8 or so, 6 to 8 weeks or so. Y'all know the white blood cell increases. I've talked to you about that multiple times, and that is always on exams and ATIs. Okay. All right. And that usually should last for a couple of days. It can stay elevated for longer, but they'll usually test, like they'll say she's 24 hours postpartum. Okay. I'm not saying it's going to stay up to 20 to 25 times 10 to 12 days, but it can stay a little elevated. What's usually going to happen is it's going to go to 20 to 25 for about 24, 48 hours and then kind of start to come back down, but it probably won't be like, 6 to whatever until about 10 to 12 days. Increase in clotting factors, Doy. So it puts them, because,
Lost a lot of blood.
lost a lot of blood, your body's going to try to kick in. However, that puts you at high risk of, DIC could happen, pulmonary embolism, an amniotic fluid embolism, any other kind of clots, DVTs, right? Varicosities decrease right after birth. What are varicosities? This is a lie, by the way, but
Varicose veins.
varicose veins, hemorrhoids is a varicosity, spider nevi. Remember we talked about all these little blood vessel things. Now hemorrhoids may last for 120 years. Okay. Because you already probably had hemorrhoids during pregnancy, and then pushing for hours at a time is going to make the hemorrhoids absolutely terrible. Okay. But they should start to come down because you don't have as much blood volume. Right. All right. So we're going to watch your vital signs. Okay. Increased heart rate, respiratory rate, and/or blood pressure may indicate infection. You should already know that. That's the beginning of sepsis, right? But if they have increased heart rate, decreased BP, that may mean that they're hemorrhaging, right? Okay. All right. So things to monitor for: amniotic fluid embolism, which we will talk about in a bit. That has a 50 to 60% mortality rate. This one is horrible. Okay. Y'all know what a pulmonary embolus, DVT, stroke, anemia, those all make sense. DIC, right? Yes. Monitor eyes and nose, you should know that, and then ambulate the patient. If we leave them laying there, they probably will get a DVT. Okay. In order to prevent a DVT, what do we do? All right. Hydration. All right. So TED hose. Oh, SCDs. That's what you're talking about. Okay.
Turn.
Yes. We want to move. Range of motion. How about ambulate should be number 1.
Yeah.
Okay, cool. And then once they have a DVT, what do we do differently if they get a DVT?
You don't compress it anymore once you already have it.
Right. So you'd have to take the TED hose off, the SCDs off, because you don't want to shoot it right up to the, and they no longer do the flexion and extension, because again, you can shoot it straight up, right? But everything else should be the same. You should still wear TED hose and SCDs on the unaffected leg. Right. All right. Okay, neurologic, carpal tunnel should go away. Remember we said a lot of moms will get that. Not everybody does, but some of them do. It is common for them to have a headache, right? But not severe headache. All right. Like a little mild headache, maybe. But remember, you can get preeclampsia and eclampsia postpartum. So if they get a bad headache, that needs to be reported immediately. Okay. It could also be CSF leakage. Now, why would they have that?
Because they didn't do a blood patch.
Okay, so they had an epidural and it's leaking and it wasn't treated then, or maybe it's a new onset CSF leakage, right? That's usually from the epidural. All right, MSK, joints stabilized by 6 to 8 weeks postpartum. Why were their joints not stabilized in the first place? Right, remember they get the laxity of the joints. Otherwise that would be really painful. Your body kept growing, but like your joints wouldn't. Permanent shoe size increase. Wow. I used to have these teeny tiny, beautiful little size 6 feet. Oh yes. Yeah. I'm a good 7. Yeah. It's bizarre. Things that stay big, your nose and your feet. Cool. And your hips. Yeah, because those aren't going to go back down to normal. Yeah, once they're stretched, they can't just like whoop. Okay. So fall precautions, obviously, because you got these big old floppy cloud feet now. All right, integumentary, cloasma. What's cloasma?
The flush. It's like melasma.
It's like melasma.
The brown mask.
Yeah, it's okay. Yeah. So that should go away, right? Resolution of partial linea nigra, right? That should, and some people that never goes away, right?
Yes.
Stretch marks should fade, not immediately. That takes a long ass time. Okay. And some of them don't fade at all. Some people, it stays red. Okay. Vascular abnormality decline. What do I mean by that? That's the varicose veins. Yeah. Spider nevi may or may not persist. Sometimes they go away. Sometimes they don't. You shouldn't be as hairy. Okay. Coarse hair may persist. You will always and forever have hairs on your chinny chin chin. It's disgusting. Everybody gets one patch. It's the most weirdest thing. You had a baby and you have this one patch of hair that will be super coarse that will grow for the rest of your life. And you have to shave it or pluck it. Otherwise it's just blowing in the wind. It's bad. And then the hair loss on your head. No big deal. So you just grow a beard and then you have no hair on your head. Hair loss postpartum can be excessive. I didn't get that for whatever reason, but a lot of people, I mean, it will just come out in giant clumps because
stress.
You're decreasing your estrogen, right? And estrogen is like, it just makes your hair all gorgeous and everything all plump and, so because of the hormone changes, there's a massive postpartum hair loss. So you'll go in the shower and be washing your hair and then it just comes out in like clumps. It's not a hot time. Like you're not looking good. Okay. So discuss postpartum hair loss, and there are hair growth shampoos. You just got to watch for try to do the non-chemical ones. Yeah. Especially for breastfeeding. Okay. Immune system. It should return back to pre-pregnant state. And remember, when they have autoimmune disorders, what happens right after delivery?
Exacerbation.
Massive exacerbation. So make sure that they have help. Okay. I can't read today. Are my glasses over there? You can have them.
Yeah.
Put your eye. Okay. Do I look smarter?
Yes.
I know. Okay. So we are going to check rubella or MMR status. Why are we checking that?
If it was passed to the
What? Well, none of the rest of y'all saying anything.
Because it can exacerbate.
Okay. Can they get the MMR in pregnancy?
No. Because
No, it's a live vaccines. They can't get it in pregnancy. So afterwards, we're going to make sure that they've had their MMR, that they are immune to it in case they have future pregnancies.
Okay.
Right. But if they do get the MMR, if they're not immune, they have to be on birth control for a month after they get it because yeah, it hurts your baby. Yes. That's why we don't get it in pregnancy. Right.
Right.
I find that super ironic.
Hold
Hold on. Can we explore this for a second? It's teratogenic to your baby, right? Okay. So you can't, even mom can't get it because it can like jack up your baby, but then they give it to all the babies when they're one. What?
Yeah. So since we all have it.
Pardon?
Like we all get it.
The MMR? Y'all get the MMR?
Don't we? Yeah.
Yes.
Like, why do we give it again in pregnancy?
No, you don't.
After?
No, they're just checking the status.
Oh, okay.
Right. For people that may not have been immune. Right. Because I don't know of any OBs who check MMR status or like do titers before, like at a preconception. Maybe some of them do, and I just don't know it. But it's just something you want them to be covered for it, but you just can't do it while they're pregnant. So you're basically like protecting like future pregnancies, right? You see what I mean?
Yeah.
Okay. If they are not immune to varicella, now would be the time to give that because we can't get that in pregnancy either because it's
live.
Right. It's live. Give the Tdap before discharge if they did not get it during pregnancy. Ideally, they want to give it to you while you're 27 to 36 weeks pregnant. Cool. Give your baby a big dose of aluminum in utero. JK. Yeah, they give a Tdap with every single pregnancy. Even if you just got pregnant like last year, they'll give it to you again. It's the purpose medically is to cover for pertussis because pertussis is more common in, I shouldn't even say more common because that's not true either. It's more dangerous in little babies. Pertussis is very common. Whooping cough is very, very common. I've diagnosed a ton of kids with it and it just presents as like a cough for a month.
Can you say no?
To the Tdap? Yes, you can. Yes, you absolutely can say no to anything. But you have to be careful about what OB you choose because some of them are very ugly about it. And you have to know your rights. because sometimes they'll say like, if you don't want to get the vitamin K shot for your infant or the hepatitis B, they'll say like, well, you can't take them home if you can't, you're not going to steal my baby. Like that's impossible.
They said that to one of my patients.
Yeah.
I sat there, I was like,
it's not true. It's a lie. They cannot steal your
same
baby.
with the footprint thing, the birth certificate. They're like,
Yes.
you can't bleed unless you get it.
No, that's not true. You absolutely, that's not true.
Or-
You don't have to do any interventions unless it is life-saving, and the hepatitis B vaccine is not life-saving, and the vitamin K shot is also not life-saving. The babies don't really need it. That's my personal opinion. Thank you. All right. And then if they need ROGAM, which who needs ROGAM?
Negative moms.
Negative moms with
Positive
positive babies, then that needs to be done within 72 hours of birth. Now that is something I would take, that's yes, of course. And I did. Okay. All right. Preparing for discharge. I think this was probably my second sheet. I think I did these in a wrong order, but that's okay. We're just going to keep going. Okay. I'm going to come back to prepare for discharge. Actually, let me come back to that. Let's keep going. All right. The uterus. Okay. There's a lot of test questions on what happens to the uterus. Okay. Okay. Uterine involution. What does that mean?
The contraction back to normal.
Back down to normal, and it should return to a non-pregnant state. All right. At the end of the third stage of labor, the uterus will be midline because the baby's
Midline or out.
out. Yeah. So it should be midline and 2 centimeters below the umbilicus, right? Because the baby's no longer up here. The baby's now
Out.
doing its thing.
Yeah.
All right. At 12 hours, now sometimes it'll rise back up, which is super weird, but it's basically like the uterus got kind of shoved down because the baby came down, and it'll kind of come back to normal, right? And then at 24 hours, it should be right at the umbilicus. Okay. And then it should go down 1 to 2 centimeters every 24 hours after that. This is highly 100% testable. Okay. Okay. All right. It should be non-palpable at your 2-week checkup. So you should go in and get usually 7 to 14-day checkup postpartum. And then it should be back to pre-pregnancy location at 6 weeks. Yeah.
Yes.
All right. After pains are common. Basically, like the labor doesn't stop when you deliver the baby, right? You're going to have contractions for the next 6 weeks. Yeah. Yeah. It's wild. Placental site. Why did I write that? I'm gonna come back to that. I don't know what I meant. Okay. Oh, heating pad is good. As long as they're not bleeding, obvi, for the, like, it feels like really bad menstrual cramps, but like times 152,000. So, a heating pad would be nice. Please make sure that you check the fundus before you apply a heating pad. The fundus should be firm and
Not wonky.
yes, that is true. And
Globular? Nope.
midline should be
There we
firm
go.
and midline. Okay. Okay. All right. You know what Lochia is? The junk that comes out afterwards. I hate saying discharge. It's such a gross word. And anytime I think discharge, it sounds very like chlamydia-y, It's just like, yeah, anything that's coming out the vag, that is Lochia. Okay. And we'll talk more about Lochia here in a bit. Okay, then what am I talking about with this placenta?
Like where, like kind of like where the fundus is?
No, because the placenta is gone.
Yeah. But do you mean like where the placenta used to be?
Maybe I mean like where my placenta go, because they steal them all, right? And you have to like
sign for them back.
yes, you have to be like, can I have my own organ?
One girl, one lady paid $500
$500 to whom?
so she could eat it.
Oh,
Her own?
she paid $500 to. Oh, she paid somebody to make placental capsules.
Yes.
Okay.
Okay.
Yeah.
No, I didn't.
Yeah, that's what I thought so
Okay.
Yeah,
too.
you
Because
just
that
make
is sounds
that
like that's
organ.
something the
I was
hospital would do,
wondering.
is make you pay for your own organ back.
Yeah, she wanted dehydrated capsules.
Oh yeah, that's a big business right now, the capsules. Yeah. I don't know how I feel about it. I haven't done enough research. So I don't really know. I didn't
So
need
a
mine,
girl
I'll tell you
did
that.
do research on it because she was curious, and she was like,
Oh.
she read a lot of articles, and she was like, there actually is no proof that the hormones actually stay in there. Because that's why people take them, is for the the natural hormones that placentas have. She was like, a lot of articles said there's no actual like benefit. Like
No, but
no
who did the
scientific-
research? I don't really trust
Yeah,
scientific
like, I
stuff
don't
with
know.
holistic things. I would want to ask like a functional OB, like a functional medicine doctor or something,
Mhm.
to find out like what the real research is,
Mhm.
All right. The word subinvolution means failure of the uterus to return to the pre-pregnant state. So if the if the uterus is not contracting back down to normal, or you notice that the fundus is not the right centimeters, then you need to check a couple things. What am I going to check?
If it's firm.
Okay, if it's firm. If it's not firm, then you're going to do
Massage.
gentle massage. Okay.
punch.
A punch to the gut. Okay. What are some other assessments you could find that you're like, well, that's not
A
normal?
pad.
Wait, what?
A heavy pad in less than
Oh,
an
like
hour.
soaking a pad in less than an hour. Yes. But I mean, like just with like her pelvis,
The
If
location
it's-
of it,
Okay. What do you mean the location?
like the sideline or something.
Okay. So if it is displaced,
Yeah.
right, then that means
Go to the bathroom.
she needs to urinate,
Yeah.
right? The bladder's distended. So you would take her to the bathroom. Yeah.
Yes.
Okay. If the fundus is boggy, what could that mean?
Hemorrhage.
Either a hemorrhage,
Infection.
an infection, because usually of a retained placenta, not always, but usually. Okay.
Okay.
All right. So, that's why we need to find out actually what's going on. If you remember when the placenta comes out, you have to check every teeny tiny part to make sure nothing gets retained because they will get a massive infection. Okay. The uterus involutes through contractions. Y'all know that. Sometimes if she's not contracting well, like especially if they decide not to breastfeed, there's no judgment there. I'm just telling you, they may need to give oxytocin to induce contractions. Tell the uterus like this is what you're supposed to do. And then once they get it started, usually it'll start doing it. But it's just like I didn't know I was supposed to. Encourage breastfeeding because breastfeeding increases oxytocin, which can help to get uterus back to, yes, thank you. Involution, some may say. All right, assess the fundus, look for boggy or displaced. We know what to do. Yeah.
Yes.
All right, assess the lochia. So lochia rubra, ruby means red. So you're just gonna straight bleed for about 3 to 4 days, perfectly normal. You said our red flag was
Soaking a pad, soaking more than one pad like an hour.
soaking more than a pad in an hour. That's why we do pad counts all the time in postpartum. I say I would never work there. I'm so sorry for you, those of you who want to. Okay. Serosa. What does the word serosa mean? No, you just read that. So serosa or serous usually means like kind of more clearer fluid, right? Like serous fluid leaking from a wound would mean more clear. So in this case, it's not clear. It's like it's not blood, right? Some of it may be old blood, which y'all know is like brownish color, right? Yeah. But it's like leukocytes and like debris from the uterus. It's just like a cleansing part. So it could be kind of all different kinds of colors. And that will continue to leak out of you for a good 22 to 27 days. It's just self-cleaning. Okay. It's cleaning out your uterus. So it's a nice thing. Lochia alba. So like an albino is white. Okay. So it's a yellow to white color. It's all kinds of stuff, bacteria, mucus, part of the decidua, the leukocyte, like everything else is just like, ugh,
So
and it comes
just, like,
out.
cleaning out.
It's cleaning out. Yeah. We're having a big garage sale and everybody's moving out. All right. And that happens for 2 to 6 weeks. By 6 weeks, you shouldn't have any discharge, right?
Got it.
All right. If they use the word trickle, okay, like there's a little trickle of blood, that can be normal, usually from tears or episiotomy, things like that. If they say there is a spurt coming out of the vagina, that's not normal. That's a hemorrhage. But please remember, postpartum hemorrhage, hardly ever you'll see it coming out of the vagina. It usually is inside, which means you got to catch it. Other thing I told y'all to do to catch a hemorrhage.
The blood pressure dropping?
Yes. Okay. So let's say you're right. Okay. So let's say the blood pressure is dropping. You look and you're like, I don't see anything. The fundus. Yes. Roller over because a lot of times that blood pools in the back and you don't want to miss it. Okay.
Yeah.
All right. Cervical changes. So the cervix should be soft right after birth. I mean, you done stretched it out. Of course, it's going to be soft, right? 2 to 3 days postpartum, it'll be shorter. It'll start to firm up a little bit. Ectocervix, which is what you can see on the outside of the cervix, not on the outside of the person. Otherwise, that would be a bad cervix. It probably is bruised because a baby's head, rushed right through. There can be lacerations to the cervix if mom was not all the way dilated when she started pushing.
So like precipitous labor kind of?
Could be precipitous labor. It could be that some moms feel the urge to push and we keep telling them like, don't push, but they like can't help it. So sometimes that can do it too. Remember I told you about the lip of the cervix. So sometimes a baby's head can kind of get caught on that and that can, cause a laceration. Oh my God, can you imagine a lacerated cervix? Ouch. Okay. The cervical os closes in 2 to 3 days, but in those 2 to 3 days, then that's going to be when you're most at risk of
hemorrhage,
infection. Correct. Because the cervical os is open, right? And so you just have this line right to the uterus. Okay. At about 1 week postpartum, they move the truck. Okay. Let me tell you something really quick.
like towed it.
Oh, I don't think
Or
so.
like
I think you just find out where it was. So, okay. So, yeah. Okay. At 1 week, they should be down to 1 centimeter dilated, still at high risk of infection. That's why you see a lot of postpartum infections, because everything doesn't back for, a little while. Yeah. It's going to take a minute. So watch their Lochia, watch the bleeding, make sure mom knows what to report, because she can hemorrhage when she goes home too. Right. Make sure that she does her postpartum follow-up, which is usually in 1 to 2 weeks with her OB. Okay. Repair any lacerations. Y'all know that you can get lacerations anywhere.
Wow.
Like when I was not delivering and not a mother, I thought it would just be like down the midline, like that's where you rip. No, sisters, you can rip anywhere.
What do you mean?
Like, okay, like here's the vaginal hole, right? Here's like the urethra, here's the clitoris. You can rip here, anywhere. You can just rip open because the baby's head is coming through. Even though it's coming through the vagina. I just thought like, oh, we're going to rip here, right? But it stretches that tissue so much, it just rips open.
Can it like rip like your clitoris as well?
Yes, it can rip your clitoris. Yes, that would be a bad day. Yeah, that's a bad day. So there's speaking of the clitoris, yeah, so there's this set of people who, how do I say this? Okay, but you've heard of like Lamaze classes. Yeah, like they prepare for birth. Well, there are some it's not Lamaze classes, but they want birthing or believe that birthing should be a sexual experience. And so the husbands or partners or whatever will do like nipple stimulation, clitoral stimulation all through the contractions. They'll like make out with their husband during the contractions because they feel like it's supposed to be like a very empowering sexual experience. I just want to let y'all know that in case you see people acting really sexual and weird, it's probably one of those people.
Okay. Good to know.
It's wild.
Wow.
There's a lot of world out there we don't know about. Okay. It is important to report any fever. It's not normal. It is normal for the white blood cell count to go up, but it's not normal for mom to have fever. So that does need to be reported, and then foul smelling Lochia. But I will tell you, as far as NCLEX questions are concerned, that hardly ever is going to be a priority.
Okay.
Not that I'm not saying you're not going to report it. You are, but that's like an infection. It would have to like get, to sepsis. It usually is something where they'll sort of clue you in on something hemorrhagey, just so you know. Okay. I don't think I've ever seen the answer be foul smelling Lochia.
So it'll always be like the blood first.
Yeah, they'll usually say that. People will go for that because it's like infection, like that's something you learn in first semester, like, report the infection. Kind of like when they ask you priority questions and they'll say like one of the patients had a wound that like looks red, like, is it a wound infection? Probably, but like there's usually something that you're going to see first because they're not going to die right there. Yeah. So I'm not saying it's never the end. I'm saying for NCLEX purposes, usually like just clue yourself in and just be kind of aware that like that may not be, don't fall for the low hanging fruit, like, infection, All right. Vagina and perineum. Okay. Y'all know the perineum is the bottom part. Was it this class where I asked what the perineum was and someone said it was their abdomen?
No,
that's a peritoneum.
No, it wasn't that, but you told us that story.
Yeah, so just making sure it wasn't y'all. I didn't think it was. That doesn't sound like you. Okay. So the decrease in estrogen will thin the vaginal walls, which makes sense because estrogen is a tissue plumper. Okay. The vagina will decrease in size and the rugae will kind of go away for a little while. The rugae is like little folds or whatever. So you shouldn't be doing it anyway, but I'm just telling you. So it should go back to like normal size. A lot of people like, there's a lot of jokes and stuff about how you're never the same again. It should go back down to normal. Any tissue that you have that stretches can eventually go back down to normal, right? And that happens usually around 6 to 10 weeks, but there's supposed to be no sexual activity. I shouldn't say no sexual activity. There should be no vaginal sexual activity. Probably not butt either, depending on if you had an episiotomy. Yeah, but you shouldn't do that before 6 weeks. Okay. Cause we're worried about infection big time. Things are still kind of open and, there's still been tears and that takes some time. People don't always do this. And then the mom ends up with really bad infection. So just wait. Okay. I don't know how you can do it less than 6 weeks anyway. Everything hurts. All right. Once ovarian function returns, so does the vaginal thickness, because when the ovarian function returns, and I mean, like when you're the return of your period, right?
Yeah.
We know there's that big increase in estrogen that makes you increase in FSH and LH. Oh my God, y'all learned some stuff this course. Okay. And so that means the estrogen's coming back. So the vaginal thickness should come back. So before that, intercourse may be very painful. What's that called when intercourse is painful?
Ooh,
dyspareunia. Yeah, dyspareunia. Yeah. So that's, less than 6 weeks, not only your risk of infection, but also everything's very like thin and pain. Like it's not the time. It's not the time. Okay. Introitus. What's the introitus? What's just the word introitus means?
Inside.
An opening. Okay, so your
Okay.
vaginal
Okay.
opening is probably going to be a little red and swollen, right?
Yep.
So don't mess with it. Leave it alone. Okay. Hemorrhoids may not completely resolve until about 6 weeks. And some moms struggle with hemorrhoids lifelong after they had the kid. Okay. Yeah. Oh, did you also know you can get vaginal hemorrhoids? Yes, you can, because you're pushing, right? And you have blood vessels in the vagina too. And so when you like sit down to go to the bathroom, it's like the worst pain of all time. Not when you're peeing, but it's just like, because when you sit down, all of that blood fills up the vessels and can be very painful. That can last for a while too. All right. So things to monitor for and to ask for ask about, I guess, not ask for, I do not want to ask for coital discomfort, but you want to ask at the OB, thank you, is vaginal dryness. That can happen until, yes, by 6 weeks, because that's when you get, what?
Because that's when your period comes back.
That's when the estrogen comes back, right?
Yes.
Yes. Coital discomfort. What is coitus? Sex. So it may be uncomfortable, right? You want to ask them about that. The dyspareunia, right? No sex for 6 weeks postpartum. You should know that. And then when they do resume sexual activity, make sure they're using lots of lubricant, because it still can be painful. I mean, you done pushed a whole watermelon out of there, so give it some time. They do need to report signs and symptoms of infections. That's something you need to educate mom on. Redness, swelling, discharge, pain. Y'all should already know that. And y'all should know hemorrhoid care, obviously. Sits baths, splash your butthole, right? With some, yeah. Witch hazel, you know what that is?
Yes.
Okay. Ice, the donut pillow, it's like yeah. Okay. Corticosteroid cream. There's one that you can actually put up your bum. Have you seen these? Yeah. So it's actually kind of cool. So it comes in like this little tube, and then it has like the tip of it looks like this. Instead of like, normal cream is like flat, but it has a tip that goes like this, and it has holes in it. So you like lubricate it, you stick it up your bum and you squeeze it. Okay. And then it comes out of all the holes. So it can kind of hit everywhere inside your butthole. So, stool softeners and fiber, obviously to prevent the hemorrhoids from coming back or getting worse. Yes.
Yes. Yeah.
All right. So we're going to do cold for 24 hours and then warm for 24 hours. Kind of the same way we do the pads, right? You do ice packs for 24 hours and then you do heat. I remember that. You do?
I do.
Okay, cool. I'm sorry to talk to you. So there's that. Okay. All right. Next one. We can do it. Okay. Pelvis. All right. So your supportive tissues just got torn all up and stretched, and then it never really coming back. That's why I put normal in quotations. Like the pelvis, probably like you're going to have birthing hips for forever. Yeah. Your pelvis will forever change because you can't untear the supportive tissues. So they're just going to be stretched. You'll forever just have a little larger hips, makes it easier for the next baby if you want to have one. By 6 months, it should return to somewhat normal. Do y'all not want to have kids, or where are we at here?
I want kids.
You do? Okay, cool. God bless you. All right.
Hey, but hopefully it's a beautiful experience.
Oh, I hope it is.
Right?
Yeah, I think if you prepare for it, it is. I prepared for Emmy's way different than Caden's. I think you just kind of create your own experience. So, all right. Encourage Kegels. That is highly testable. And what are Kegels?
The pelvic floor exercise.
Pelvic floor exercise. Pelvic floor re-strengthening is a huge new market. Yes. All right. And we talked about, I told you about that new invention that somebody came out with. I didn't tell you about this. Are you sure? Because I feel like I did.
Maybe
Describe it.
Okay. So they did a crowdsource. Crowdsourcing is. Okay, so apparently I told you nothing. All right. So crowdsourcing is when you have like this brilliant idea, but you don't have any money. And so it's kind of like a GoFundMe, but it's better because when you crowdsource something, people can give money in different tiers, and then you give them different things based off of what tier. So, if you don't raise enough money, then everybody gets their money back, right?
Oh.
Because otherwise you can't do yours. So let's say these people wanted $250,000 to start this company. They have this brilliant idea. They crowdsource it out, and people can decide to be like gold, silver, bronze. And it'll say things like if you're gold, like you're the first person that will get the product, or you get, free subscription for a certain amount of months. So that's how the crowdsourcing works. So this lady had this brilliant idea and she crowdsourced it, and she got enough money like that. So obviously it was a somewhat good idea. And so it's a video game for pelvic floor re-strengthening. A video game.
Do you shoot people or something every time you
So do y'all remember? Yeah, I know y'all are way too young, but maybe you know what it is. Have you ever heard of like an Atari game system? The stick?
Yeah.
Right?
Yes.
Yeah.
The
stick.
stick.
Okay, yeah.
So it's a remote control that you insert into the vagina, And then it's like Super Mario Kart. I'd be like, go to the left, go to the right, go jump, jump. Yeah. And then jump. Yeah. And so supposedly it's like really a big deal. It like works really good. And it made a lot of money. So that's an option, you know, if people are open to that kind of thing.
So what does that help? Like, I know like pelvic floor re-strengthening, but like, what does that?
Oh, great.
What is your
That's
end goal
very, okay.
with
So your
that?
end goal, okay, first of all, Kegels will help to get the vagina back to normal size and shape.
Okay.
Secondly, because everything got stretched, your organs can fall out. Right.
Oh,
So you
got
can
it.
get like your uterus can come out. You can get your bladder can come out. You've heard of moms like joking around before, like every time I sneeze, I pee.
Yeah.
Yeah, that's because of a weak pelvic floor. So when you pushed, all your organs really got displaced. And so if you have a very weak pelvic floor, there's no muscles to hold the uterus, the bladder, the vagina in place. And so people can actually have like prolapses. Vaginal a prolapse means it comes out.
Yeah.
So vaginal, and it doesn't have to completely like come out of the hole,
But even just a
but
little bit.
right. So you would like, and you can tell if they have it, because if you did like an exam and you stuck your fingers in the vagina, and you tell them like bear down, you can actually feel a protrusion. Either the rectum is coming through, there's a rectal prolapse, there's a uterine prolapse, there's vaginal prolapse. That's because there's not enough strength in there to keep all of your organs pulled up where they belong. So interesting side note, you won't be tested on this, but this is, I watched a documentary on this because my very best friend at the time, his aunt, I think, she worked at this very like fancy law firm in Galveston, and they were doing all of these lawsuits. And so he would bring over all the papers. We'd start going through all the medical records, right? What was very popular, I would say this was probably 15 years ago, was to do what's called a vaginal mesh. And so they would take basically like a sling and like use it to like pull the vagina up, and then they would sew it into the abdominal cavity. But it was a mesh, right? And so the mesh grew into all of the organs and started causing massive autoimmune disorders and infections because they didn't test it long enough before they put it on them. And they were putting these in like mad, like these were the brand new, oh my God, we're going to lift everything and everything's gonna be so great, yada, yada. And so when they would go to like remove them, because they were having these massive, you can't remove it because the mesh had actually grown into the tissues. There were people getting hysterectomies and they were having a partial like vaginal reconstruction, and like it was horrible for a very long time. So they don't do that anymore, which is why pelvic floor re-strengthening is a new big thing, because they can't really do surgeries for it that well. I mean, they can obviously, like if the rectum prolapses, they can pull it back in and kind of try to, but it's not going to stay because your muscles are too weak. So that's why this market is so big and it's so new, and so many moms struggle from it, but nobody really talks about it, you know, because they just think like, oh, it's part of being postpartum mom or part of like motherhood. It doesn't have to be that way, right? So Kegel, very, very important. Pelvic floor re-strengthening, very important. And there's referrals that you can do to get them to the right person. Monitor for pelvic relaxation. That means basically the pelvis is going to just kind of drop further into the cavity, and that's what's going to put you more at risk of the vaginal prolapse, rectal prolapse, uterine prolapse. Okay. Okay. And you can tell like how strong their pelvic floor is when they come in for postpartum. But I wouldn't do it at the 2 weeks because the risk of infection is too high. Yeah. Maybe a 6-week postpartum visit. You can do the vaginal exam and then just tell them to clamp down. You don't know how to clamp down. Y'all know how to do. Okay. Oh, you said it too weird. She was like, yeah. So you'll tell them like to clamp down, and you can see like how strong their vaginal muscles are clamping around your fingers. Okay. All right. Abdomen. So you still look pregnant after you pregnant. People, except for those people on Instagram, I don't know how they do that. They come out wearing their pre-pregnancy white pants, and I'm like, I don't know how that happened, but it does not look like that. Okay. You still look very pregnant because your uterus is still big and you still have a ton of fluid, and like you still have this giant pouch, and that sometimes never goes away. So at 6 weeks, it should return to quote normal, but I think that's unrealistic. I think it might take longer. Yeah. I mean, because you've birthed a human. I mean, come on. Monitor for diastasis recti abdominis. Did we talk about this before?
Yeah, you said it was when like, you know, where your abs are.
Yeah.
Like,
So those
like,
separate,
open.
and it can be very painful.
Ow.
And they can't work out. So they're like these, and these are usually very athletic people, who had very strong, abdominal muscles anyway, because that would make more sense. Cause if their muscles were already really tight and then they stretched, it pulls. And so we can send them to physical therapy, or sometimes they may need to do surgery. All right. Endocrine. So all of our placental hormones are going to rapidly decrease. I mean, this is all of them. So I'm not going to read them to you, but all of them are going to decrease, which is what can cause postpartum
Depression.
Yes. Okay. Because you just had all these hormones for forever, and then all of a sudden you just they're gone, and it makes you like really sad. If you are not breastfeeding, they can return to menstruation in about 12 weeks, sometimes even less than that. Okay. If you're breastfeeding, remember, usually when you're breastfeeding, if you're solely breastfeeding, you do not have a period, which they'll consider breastfeeding a birth control, right? Because you're not ovulating. But that can happen at any time and you won't know it, right? And remember, I think we talked about this somewhere in PD or something. You have to be like exclusively breastfeeding, like every 2 to 3 hours, pretty much around the clock, right? It can't be like supplementing or anything like that. Like you're just breastfeeding. Oh, but here's the thing. You can ovulate before your menstrual cycle returns, right? So let's say you're solely breastfeeding, you're doing the thing. I mean, there's no guarantee that you're not going to ovulate and you won't know when you do. So a lot of people can, that's how you get Irish twins. Have you ever heard of Irish twins? I don't know if I'm allowed to say that anymore. Is that racist? I don't know.
No, I mean,
okay. I feel like you can't call anything by its name anymore. Like Spanish flu, we shouldn't say that either. But you know what I'm talking about, like where they have babies like super close together, because mom did not know obviously that she was ovulating or gonna start the period, right? So breastfeeding is not 100%, but it does work pretty good. They have increased prolactin in breastfeeding. You should know that prolactin helps you to lactate. All right. As the estrogen starts to decrease, remember estrogen causes fluid retention, right? Then that's how mom is going to get rid of that extra fluid. Now, sometimes that does not happen. And remember, she's still at risk of preeclampsia and eclampsia postpartum. So you do still have to check for blood pressure after birth. Okay. Discuss contraception. What's she going to do? What are her options if she's breastfeeding? Progestin only. If she is not breastfeeding, then you have pretty much all of the options, but don't choose like, you can't put in a new ring or any of that, like right after you've given birth, that sucker going to fall right out or go back up. Who knows? All right. Educate regarding signs and symptoms of PPD and PPP. What's PPD? Postpartum depression, and PPP? Postpartum psychosis. What is the difference between postpartum depression and postpartum psychosis?
Psychosis, you're at like a higher risk of killing your baby.
Yes, in psychosis, you have thoughts of usually harming yourself or harming your baby. It doesn't mean you're going to go through with them, and it can be very scary to some people, when they think that thought. I'm not saying that they're like evil and they're like, I'm going to kill this baby, and they like try to find a way to do it. They get scared by their own thoughts of that, right? Lactation consultation should be mandatory before you leave the hospital. It's not, but it should be. And just so y'all know, if y'all do deliver in a hospital at some point, always ask for this. It is included in your delivery, and you should get, like, even if you're breastfeeding like a champ, get it done before you leave, because once you leave, it's no longer covered by insurance and it's very expensive. So
Women's Hospital got rid of lactation.
Women's Hospital got rid of lactation.
Oh, UTB had theirs.
They just got rid of
Each patient literally had one come
during
in.
our clinical, they got rid of it.
Yeah.
That lactation consultant at Texas Women's is what saved my breastfeeding with my daughter.
It helped my patient
They're
with
into like
breastfeeding.
firing them, so all of them just quit, and they were like such good team, so they all like just left together.
Their lactation consultants were amazing.
Yeah.
Amazing. Like Emmy couldn't eat until she was 12 days old because she was in the NICU. And so they're like, you can try to breastfeed. I've been pumping. And they're like, but the nurses were like, you may not be successful. She's never had a boob in her mouth. So how would she know? She may not do it. You may have to pump exclusively. And I had already done that with Kaden, and I was like crying. I was like, I don't want to do this. And then the lactation consultant came in with her beautiful soul, and she talked like this. And she was like, this is going to happen for you. La, 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 la. Then she did some kind of magic spell. And then this baby just latched on, and then she didn't latch off till she was like 18 months old. All right. Breast care, very important. What do you do? Oh, should the nipples be bleeding? No. Should they be, they can be sore, right? Yeah. But if you have like raw bleeding nipples, what does that mean? It's not mastitis. Baby's not latching properly. Breastfeeding does not hurt. It feels weird. Okay. But it does not hurt. So if babies latch and it hurts, that's an improper latch. So what would you do?
Put them further in. Oh, colostrum.
Relatch. So how do you get them to relatch? Because you can't just pull them off a nipple.
Put your finger in.
Yeah. So you remember you stick their finger on, try to break the seal so you don't like rip the nipple off, and then try to relatch. Yes.
Yeah.
Okay. Oh, there's also something called lanolin cream that you can buy. It's like a nipple cream, but I think there's better things that you can use that are more natural, because the lanolin cream you have to wipe off prior to baby relatching. Because if it's not meant for baby, then I probably shouldn't put it on my nipples. Like coconut oil can be very helpful. There's lots of different things that you can do, but
does it have to only be like colostrum, or can it just be like regular milk also? That you
what? For what?
Can't you rub that on your nipples also?
Oh yeah, you can rub your breast milk and stuff, but it's not going to help to really protect it super much. It'll more help to make the baby more excited about feeding. The colostrum may be a little helpful, but you're only going to get that for a couple days, right?
Okay.
So I think I use coconut oil. That's probably the best. It's very soothing. It also has antimicrobial factors too. All right, and urinary, your kidney function should be normal at about 1 month postpartum. Because remember when they were pregnant, the ureters were dilated. And they got a lot more blood flow to the kidney, which is what made you pee a lot when you were pregnant, right? No,
yes.
I said you, it wasn't you. So dilation of ureters in the renal pelvis, but that can still last up to 6 months. Plus you're getting rid of all that extra fluid, and that, just sometimes takes a while. Glucosuria will stop at 1 week postpartum. So when you are delivering, obviously that's a very stressful situation. So your blood sugar may increase. That's right. Yes, everyone. And then your kidneys though will kick in and get rid of the extra. So that should stop at about
6 months.
Thank you. A week. Thank you.
1 week.
1 week. Yep. BUN may still stay elevated. That's fine. And nobody mad about that. You will have profuse diuresis for 12 hours because you're getting rid of all that extra fluid. So they're going to pee a lot, and that's perfectly normal. Okay. Do monitor for bladder distension. How do I know they have it?
If their uterus is
displaced, okay, because that can cause excessive bleeding because the uterus is not going to be able to contract if it is displaced. Okay, so if you see fundal displacement, okay, and I say cath first, if they can go to the bathroom, obviously that would be a better choice, right? Okay. But if they've had an epidural and their legs don't work, you may have to cath them. Yeah. And then reassess afterwards to make sure that the fundus is back normal. They should void within 6 to 8 hours after birth, because remember, they've lost a lot of fluids. They probably won't pee that much right after, but then 6 to 8 hours afterwards, that should do. And make sure they empty the bladder completely, so they may have to push down as if they're having a bowel movement to get all of the, plus you've had an epidural, so your bladder doesn't want to completely empty. And if you don't completely empty it, you're going to get a UTI. Yes. Okay. All right, GI, you're going to be hungry as hell. That first meal after giving birth is like the best thing you have ever had in your life. Okay. Now, bowel movements may not occur for 2 to 3 days postpartum. You have to prepare the mother for this experience. Everything is torn and broken, and your stool is going to be hard, and it is like giving birth all over again. So make sure that she is taking a stool softener. And remember, you're still on prenatal vitamins, even postpartum, which has iron.
Conservation.
Right. Yeah, and your body, there's just something about your body that's like, I don't want anything else coming out of there. So like it just like holds on to poop. Yeah. Anal incontinence may happen. What a day. With 3rd and 4th degree episiotomies, because remember that goes all the way through to the like close to the anus. The 4th degree obviously goes all the way through. Now I can't imagine what that bowel movement would be like.
Ow.
Oh my God.
Wouldn't that be at like a really high risk of infection?
Yes, a very high risk because yeah. So they may leak out of their bottom because you had a cut. I mean, that's bad. On top of all the other stuff that's leaking out. That's probably, you probably don't even know. All right. You can resume a normal diet once you're tolerating full liquids. Remember, a lot of moms puke during labor, right? And so once they like feel okay and like they can drink, they're like, here, drink, not too much. Then they can eat. Okay. Stool softeners, and then everybody gets the squirt bottle, and that should be done whether you pee, whether you poop, no matter what, you squirt it. Okay. Over the toilet. Y'all know that, right?
Yes.
Otherwise it gets very messy. Okay. All right. Breasts. So breastfeeding, we know colostrum comes first.
Yes.
And we remember too that baby's stomach is only the size of a
peanut or
peanut.
Ping pong ball.
A ping pong ball, peanut. What? For the first couple of days. So they don't need much. Really, they're just sucking to get the colostrum. Even 1 to 2 mLs is perfectly fine. Okay. Milk comes in at 3 to 4 days, and the breasts are going to feel tender, full, maybe nodular, kind of weird. Engorgement, all of that is normal. You know what engorgement is? Yeah. Okay. How do we fix engorgement?
Massage it.
Breastfeed.
Get it out.
Yeah. Or they can do a warm shower. Let's see, what else would I tell you? I wouldn't use a heating pad per se, but like warm is going to help you. So if you just go and stand in a warm shower, it will initiate your letdown reflex. You'll start squirting milk all over the shower and just let it go. Okay. That can help because your body is trying to figure out how much your baby needs. Right. I wouldn't recommend pumping until they're empty, but I would recommend going ahead and latching baby on and then maybe pumping for a few minutes afterwards. But if you completely pump and then latch baby on, you're telling your brain, I need that amount of milk plus more milk. So it's just going to keep making more milk, right? Which is why if a mom is not going to breastfeed, You do not have her pump to relieve engorgement, right? Because if she pumps, that tells her brain you're breastfeeding and it'll continue to make more milk. You also would not do a hot shower for a mom that is not wanting to breastfeed, right? You don't want heat or anything to let go of the milk. You want it. So if she's trying not to breastfeed, you put her in a very supportive, tight bra. They will do ice instead of heat, right? And cabbage leaves, which dry up milk. Okay, so the plan is very different depending on what you're doing, right? If they're not breastfeeding, the prolactin will eventually go down, but the breast can be very tender and very engorged, and they're still at high risk of mastitis because they're not getting rid of the milk. Okay, so if they're breastfeeding, we want everything to be warm. Okay, breastfeed often. I mean, these babies cluster feed, right? So I don't recommend schedule feeding because the baby doesn't know what schedule they're on, right? And your milk changes every feed. So sometimes they may get more water from you. Sometimes they may get more fat from you, right? Remember, the fore milk is very watery, right? It's thinner, and that's meant to satiate the thirst. The hind milk is the heavy, like it's thicker, it has more fat. So you want to completely empty one breast before you move to the next one, right? So 15 to 20 minutes on one side and then go over to the next one. Baby may not finish the second side. So when they have their next feed in 2 hours, you start on the side that they didn't finish and then you rotate that way. That way you don't get mastitis. Okay. Breastfeeding should not hurt. And the babies cluster feed. That's the other thing you have to tell parents. Is that the baby may feed and then 30 minutes later they may feed again, and then 45 minutes later they may feed again, and then they may go 2 hours, 3 hours. The baby just feeds when baby is hungry, and that's it, right? And breast milk is so easily digestible, they're hungry a lot, right? So you may be feeding like cluster, y'all know what cluster feeding, where they do a whole bunch at one time. All right. If they are engorged, they can also do manual expression if they don't want to pump. So just like squeeze out enough to like not be super uncomfortable. Okay. If they're not breastfeeding, right? So we're going to do the tight bra, the ice packs, give them some analgesics, and cool cabbage leaves is always on the ATI. Okay. 15 to 20 minutes on, 45 minutes off. Do not do heat and do not manually express, because that will tell your brain, make more milk. Do we understand what to do? Okay. So the next thing is the Rita scale. So I think I included this in your handouts before, but I really want to talk about it here. Oh, hello, little lady. So the Rita scale is a scale that we're going to use to see how well they're healing down there. Okay. So do they have redness, edema? What's ecchymosis? Bruising. Is there discharge? And then approximation is like, is it open or closed? Okay. So we just use that score in order to look and see. I mean, honestly, you could just look, but whatevs. Anyway, these are the things that you're going to be looking for, is like redness, edema, ecchymosis, discharge, and approximation. I don't know if any hospital actually uses this, but I just wanted to mention it. Okay. All right. Questions, comments on that section?
No, prepare for discharge.
Oh, thank you. Prepare for discharge. You prepare for discharge. Okay. Prepare for discharge. So how can they go home, or how do they know when they're going to go home? They can ambulate on their own. Okay. We have maintained adequate pain relief. Okay, they have control of bowel and bladder, which means they don't have to poop, but they have to pass gas and they have to be urinating on their own. The fundus needs to be firm. I put Lochia midline. I'm so sorry. I meant fundus midline. Sorry. They had to have rested in some kind of way. You cannot send this mom home completely sleep deprived, because they will fall asleep on their baby. They will drop their baby, we have to have some kind of feeding established. She needs to decide whether she's formula or breast, and we have to see that the baby actually can feed before they go home. And then they have to have a car seat. Like, you have to bring it to the unit to show them you have a car seat. Got it. Oh, I didn't finish. Sorry. Pain management. Okay. Perineal care. Y'all know what to do for this. Squirt bottle. Hemorrhoid care, sitz baths. Okay. Witch hazel. I love that name. I named my kid Witch Hazel. Yeah, it's a good toner and things like that. Yeah, you can use it for anything, and it costs like $1, so maybe turn in your expensive things. All right. Good hand hygiene, especially when you're doing perineal hygiene, because basic newborn care, which I cover in a different module, but you have to, that's part of your job as the mom and baby nurse, is to make sure you do all of the teaching for newborn care. Check their immunization status, especially for MMR, Tdap, varicella. Okay. You want to discuss different birth control options before they go home, because you may not see them again. Discuss Kegel exercises and how to do that. Prenatal vitamins need to continue for 6 weeks postpartum. So, pooping is going to be an issue. Make sure she's on stool softeners and fluids, fiber mobility.
Okay.
If they are not breastfeeding, they basically go back to a regular normal diet, right? If they are breastfeeding, they need up to 2,700 calories per day. That's so great. All right, fluids, fiber mobility, I already told you that. They need to breastfeed within 1 to 2 hours after birth. That is ideal in order to establish a good milk supply. And it doesn't have to just be breastfeeding. Let's say baby goes to NICU, you can get her a pump. Okay. Psychosocial care must be hard being a new mom, that kind of thing. Okay. They can resume sexual activity 6 weeks after birth. Got it?
Yes.
Okay.